Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology.
It's so good that you're asking the question what you would expect at the chemotherapy treatment appointments. It's a great idea to be asking this before your first appointment, which is usually a lot longer, and even before the other appointments as well, as things might change. I think the hardest thing for patients is that even the word chemotherapy is so scary. So, the first thing I would say to expect is to be okay with the fact that you might be a little apprehensive. Expect that you might feel nervous that day. However, you usually feel nerves, butterflies in the stomach, or just not feeling quite yourself. That's okay. That's very normal for you to feel. And when you get there, what you can expect is that you might be in a room with others, and it could be a lot of people. So, some chemotherapy rooms maybe house even 8 or 10 patients. Sometimes certain patients will have a private room. You might be one of those if you need it. And at other times, you'll see a lot of patients getting chemo at one time. So don't be surprised, don't be dismayed. That's very normal. Everyone is usually sitting in what would be called like an easy chair or some type of a lazy boy or hospital chair, typically where your feet can be put up. And I have to tell you that because of the nature of what you're about to do, you can expect it to be cold. So, usually the temperature is quite cool. And I have yet to hear a patient who didn't say they made sure they wore warm clothes, had socks on their feet, and even brought a blanket. So, bringing a blanket is a great idea. They might provide them there for you too, but have one with you in any case. And there's some other particulars depending on what the nature of your medication will be that we will be covering that you will begin to prepare and take with you. But on the very first day, expect to be there for a while. And the best thing about expectation on your first day is that you will have a nurse who will tell you what's going on. Expect them to outline every medication that will be infused. Expect them to tell you what the medication is for, even what feelings you might have afterwards, what possible side effects there are. You know it's infusion, so expect there to be needles. And if you have a needle phobia or any kind of worries about needles, you can thoroughly expect your nurse to be ready to help you with that because they have a lot of experience in this area. So it's understandable that you'd like to know what to expect, and it's good to be prepared. But remember that you can be ready for it by knowing what you're up against, by looking it head on, and knowing that the nurses are there to help you every step of the way.